2020 was arguably the most eventful year on record for telehealth as the COVID-19 pandemic accelerated the use of video-enabled visits by individuals and providers. Here to discuss a recent Best Special Report on the subject are Jennifer Asamoah and Iachetta, Senior Financial Analyst at AM Best. And Jennifer, we're going to start with you. Telehealth visits have obviously soared during the pandemic. Prior to that, though, what reasons were there for people not embracing telehealth?
Thanks, John. So telehealth has been a positive impact on the health industry, but pre-pandemic usage was very minimal at best. This was mainly due to lack of reimbursement models and overall usage by both individuals and providers. No doubt, 2020 was the most eventful year on record for telehealth services as COVID-19 began to take hold and stay-at-home orders were implemented. This actually helped aid the widespread use of telehealth services. The industry also adopted videos to connect individuals to their providers. Virtual visit provided individuals with the flexibility and the convenience of being in their homes to connect to their providers. We also saw a lot of health insurance waive cost sharing, which also aided in facilitating the wide use of telehealth services.
Jennifer, could you talk about how the wider use of telehealth benefits insurers?
Yeah, so virtual visits were used for health screening, and at the same time, it was used to provide non-emergency services by providers. So telehealth provided individuals the chance to seek additional treatment for their chronic conditions. We saw a lot of health insurance reached out to individuals who had higher risk conditions who were likely to forgo care during the pandemic. And in some cases, we saw care managers intervene and to help these individuals manage their condition during the pandemic. The fact that health insurance covered these type of services or virtual visit also helped these individuals with higher risk conditions manage their well-being and expenses associated with their condition. We've seen a lot of telehealth visit claims come through, but ultimately the impact on health outcome remains to be seen.
Antonietta, to what extent has telehealth become an access point for mental health services?
Great question. So I just want to preface this question with the fact that prior to the pandemic, studies have shown that in the United States, 1 in 5 adults were diagnosed with varying degrees of mental illness, and only half of these were receiving care. In the past, this was largely due to affordability, stigma that's often associated with mental illness, and also lack of provider access, which, especially for those that are living in rural areas, that could be difficult to gain access. And pointing to the data is shown that behavioral and mental health conditions accounted for more than 50% of telehealth claims through October of 2020, and that's a 33% increase from the prior year. This is testament to the expansion of home delivery of telehealth for virtually all diagnoses during a public health emergency. Wanting to add that neglecting mental illness over an extended period of time can have adverse impact on an individual. And telehealth offers a critical avenue not only to sustain mental and behavioral health, but also to increase the overall well-being of an individual.
Now, once the pandemic eases or is behind us, Antonietta, do you think this increased usage will continue?
Thank you, John. Great question. So through September 2020, the usage of telehealth had decreased as we were seeing many patients returning to in-person visits. But despite the decrease from the peak usage we had seen in April, the overall usage of telehealth remained significantly higher than before the pandemic. Now, while some health carriers had been previously offering plan designs that included virtual component and reduced copays, a lot has changed during the pandemic as we've seen health insurance kind of jumping in and adopting quickly. Health companies invested in and enhanced access through community center resources to reach low-income individuals, for example, We also seen some other carriers where they launch new virtual care models, where the foundation of their program was virtual care. And these changes, these changes evidence a certain level of permanency that did occur. Also, wanted to bring up a survey on the industry that found that about a quarter of the respondents that participated in the survey said that they would prefer a virtual visit once the pandemic is over. And over half of the respondents were willing to use telehealth for behavioral visits, indicating, again, a certain adoption had taken place. Again, given the increase we're seeing in the number of individuals that are interested in using telehealth, virtual care will continue to evolve over time, and perhaps in the future it might lead to better means of delivering virtual care.
Thanks, Antonietta. Jennifer.
Thank you, John.
Thank you.
That was Jennifer Asamoah and Antonietta Iachetta, Senior Financial Analyst at AM Best. You can find the full report online at ambest.com. For AM Best TV, I'm John Weber.